Hello, good evening. I have done this video twice today and I've erased it twice because I just wasn't happy with it. It was too long, too carried out. So now I'm going to try and bring all this information in my medical health records to you to help you better understand how it is I ended up in the situation of having a parasite infection. And excuse me. Indeed, that's what it is. It was then, and it still is now. I know, I live with it. And 100%, no one's going to tell me any different. So anyway, let's just cut to the chase here. What I have here is my medical health records. In part, some of them. Anyway, this was September 4th, 2020. It says on my report, fixed delusion, parasite infestation. Not open to this diagnosis. Okay, I just have a little footnote for that. Well, she might have insinuated or alluded to that topic, and I cut it short and I nipped it in the bud, or and then she was encouraging me to get some kind of counseling, but I figured that was for my bereavement. That was because I lost my child in 2017, and I was so sad. I was grieving, and I thought that she was trying to do that, and I was like, oh well, maybe you know. So anyway, let me read on. Not open to this diagnosis. I think she was referring to me because she was alluding to that, and I was like, no, absolutely not, because that's how I would respond. But never did I put two and two together that all of a sudden this was going to be embedded in my health records, and that this was going to identify me, and that this might be in part why I'm being prevented from getting the help that I need. Previously assessed by derm no DX, I guess no diagnosis, referred to ID, that's an infectious disease, September 2020 for final opinion. No further investigations, no further anti-parasitic treatments, but let's stop there because you know what? I'm really looking forward to dissecting my health records, because I'm pretty sure we aren't going to find very many anti-parasitic treatments going on here. Okay, and so no further anti-parasitic treatments unless clear diagnosis identified. Yeah, this was the catalyst. I do say, this is the start of the propagation of bullshit, of a gross misdiagnosis that has been devastating to me. It has affected all facets of my life, physically, emotionally, but not because I suffer a psychosis called delusional fixation or delusional parasitic. No. It's because these people got together and claimed I did. And it has been a hell of a tormenting, sometimes very hopeless looking, feeling kind of way for me. Let's get back to this. That's the general GP started that, okay? So we're gonna move on here to infectious disease. Yeah. I'm not going to say doctors' names at this time. You know, that's not what this is about. my personal attacks on them will be in a court of law. However, I have every right to divulge and expose how I was treated and how this all came down. So, I'm going to carry on. Dear doctor, my general practitioner, this is from the ID. I spoke with Leslie via telehealth today. She was very animated and combative on the telephone, saying us physicians don't care. Facial rash unchanged with the hydrocortisone, but no evidence of MRSA associated bullous and pitago at the physical 2 weeks ago. Yeah. I remember when I had a physical with him. Yep. He didn't do much. That's what I remember. Anyway, he goes on. She was requesting a stool test for Dipylidium caninum, the dog tapeworm. However, we should have seen the ova in her stools on prior ONP. I did send her another requisition for high-risk ONP. However, if the stool ONP is negative, I will follow up after the colonoscopy. If the colonoscopy is negative, we may have to consider psychiatry referral for delusional parasitic. That's his first letter. Second letter. Dear doctor, I spoke with Leslie today. Again, we have not found any evidence of ongoing parasitic disease. Multiple repeat stool OMP have been negative for intestinal disease and serology, negative for extraintestinal. Still having LLQ, abdominal pain, and stools that are soft with tissue pieces. I've referred her to Dr. such and such for colonoscopy. I will also refer her on to Dr. David Harris, who is an... I didn't mean to say that. Anyway, I'm going to continue. He's an ID doctor who does have an interest in delusional parasitic. I will not see any more names. I apologize. Please take that off. Please disregard. Just a slip of the tongue. Okay. And then I do have this here. And pardon me, it's right here. Yeah, and then, so then we go on. So that's 3 doctors that are all in on this conspiracy pretty well, because they can't find what is ailing me and still is ailing me. It became a mental health disorder. Never been to a psychiatrist, never seen a psychologist, haven't had a meltdown. Yes, sometimes I might come off as a little strange. I am unique. And may I also bring to your attention that I contracted this in 2016. From 2016 to 2020, I was trying to tell them what I have, which is what I have now. A parasite infection. All through me. Okay. I also was bereaving the loss of my child, as I've mentioned in previous videos. Yes. Very sad time for me. Yes, at times I didn't feel myself. Of course. But this that I feel still going on and have proof of has nothing to do with mental health issues or psychosis, and never has, never did. It's something that you doctors forced on me and then embedded in my health records, which prevents me now from getting help because it's the program. I don't care which way you look at it. This is my life. This is what I'm experiencing. This is the revolving door I'm being pushed through. These are the answers I'm getting constant all the time. Subpar. Subpar. This medical system, I ain't interested in paying for it anymore. You know? It's a subpar system run by subpar people. And I don't care. Yeah. So what if an academic has degrees? So what? You know, I could care less, you know, because I'm going to tell you, I've met academics that have absolutely no common sense. None. I've worked for them. I witnessed it with my own eyes. God bless them. Okay. Excuse me. So, thank you, Mr. Infectious Disease Doctor. So moving on. Yeah. So, here's something else on a summary chart, or chart summary. Thank you for seeing Leslie Mills-LeBlanc for delusional parasitic. She was seen by Dr. Buddy. He mentioned he would refer this patient to you for further assessment. Okay, I want you all to be very clear, okay, about how when, you know, my original GP was, you know, talking this nonsense about it not being real and yada yada yada, I really wasn't connecting that I was being passed around under the premise of having delusional parasitic. I thought, you know, that I really thought that they were, like, I might have mentioned to Dr. Harris that she was wrong, maybe, but I didn't realize how much this implicated me, but in such a false manner. It's so far from the truth. It's disgusting. And the proof is in the pudding, because here I am, okay, and I look at my top of my nose, okay? Let me show you something. Okay, here we are. Okay, I feel it moving. Okay, enough is enough. Enough is enough. I'm a grown-ass woman. I've lived with this since 2016. I'm not having it anymore, doctors. All right. So let's move on. So that's 3 doctors, right? 1, 2, 3. Yep. So let's move on to this next letter, because I certainly don't want to leave this person out. This person sounds kind of almost pompous. I don't know. Just for someone who's really striving to gain brownie points. I spoke with Leslie on the phone today. The interaction was tenuous, but not hostile. She continues to struggle and tells me that the rash is progressively worse and that she's now desperate for a solution, despite this being present for at least 2, potentially 4 years. You're right. And aren't you lucky that, you know what, I'm a strong, strong individual with a sound mind and a good heart. Aren't you lucky? Because just by that statement alone, it shows me that you don't really have any compassion and you don't have any empathy, and that you made a judgment when you shouldn't have. Yeah, I have suffered 2 to 4 years. You want to know why? Because none of you are listening and none of you are taking me at face value. No, you'd prefer to make up some ailment, some mental health illness, so that you don't have to put in the work. Or maybe you're told not to. You know, it really begs the question, why? I mean, doctors are supposed to help people get better. Doctors are supposed to usually be interested in getting to the bottom of things that are causing people pain, causing people discomfort, causing people fear. Like, do your jobs, doctors. Do your jobs. So let me carry on. She has done her own research and thinks she may have Bailey's scarius, which I did. It's caused by roundworm found in raccoons. Yada, yada, yada. You know, I do have a history of living in the United States. You know, even at one point I was very sick. I was staying at a homeless shelter and I became very sick, I think from swimming in the ocean, and I wasn't allowed to be in the homeless shelter during the day. So during the day, when I wasn't working, I had to find shade because I was very, very ill. And there was a little park with a little turtle koi fish pool, and or maybe it was frogs. Big fat toads and koi fish. That's what it was, maybe. And, you know, I remember just hanging out with them and feeding them and blah, blah, blah. And who knows? And I was wearing contact lenses. Like, there's any number of ways I could have contracted this. I even ate raw pork for a week, being stupid. You know, there's any... You know, I gave them several reasons, just not one reason. I've given doctors several reasons over the years. I've talked about these things over and over. So anyway, let's just move on here and let me finish with this fourth doctor, who is of the opinion that I might have a few screws loose, and it's all in my imagination when I feel them moving. You know, when I feel it in my neck, when I feel it in my head, it's all in my imagination. You know, it's not really moving. Okay, overall, I do not have a clear diagnosis for the patient. She does have many behavioral features that suggest there may be a psychiatric issue underlying this possibly delusional parasitosis. I've not given her any treatments despite her requesting L-benzodyl today. I'll follow up by phone when results are available. Sincerely, said medical practitioner. So there you have it, folks. There's 3. So I also want to point out one other thing here too. These damn academics that think that they're so damn effing smart. Well, I'll tell you what. If you're so damn smart and y'all think I have this psychosis that I pick at my face, you know, that is, this sort of thing is, let's be real, okay? And I'm going to call you all out. Any day, any time. I would love it if you took my blood and tested it for drugs. Anytime. Actually, I challenge any doctor. I would like somebody to take my blood. Because basically what it comes down to is this. A psychosis is usually, you find people addicted to meth who are in there picking away at sores or picking away at something that the doctors say isn't there. Well, who the fuck knows? Because you know what? Those people are on drugs, so it's very easy to make those people look crazy. That, it's possible they have delusional fixation. That's very possible. Okay? No. I was a woman who is bereaving her daughter's loss. I'm afflicted by a parasite infection. You people, because you didn't want to do your jobs, decided that you would label me with a mental health issue. Okay? And the purpose of this video is to prove how this has followed me, that it's not just a matter of me crying and venting and whining about discrimination and not being able to back my shit, because I'm going to right now. I'm gonna right now, okay? One moment. Let me queue up. I'll be right back.
So I looked through some of the previous ones. Did you take that PARASITE? It was the medication from BGH not long ago.
Yeah, that's not gonna do it.
Didn't do it, eh?
This is please, please.
Can I try giving you a couple of treatments here in the emergency to make sure your symptoms better?
I have to get it out of me. It's not gonna make my symptoms better.
Yeah.
The way to treat it is with Praziquantel. Okay.
That's what
meant to
was
say ivermectin.
prescribed.
Yeah.
Did it work?
No.
So
This is like.
Yeah. So what we're left with.
Can you see this?
So I don't see any parasites.
No, this on my nose.
I do see scabs, but I don't see parasites, and I don't think you have parasites.
What do you think I have, doctor?
So I think that there was a condition where people feel like they have parasites, and I think that's what you.
Oh, really? Oh, so you can clearly see this on my face right now, and you're saying that these are symptoms of what?
It's called parasitosis, where it's a feeling of having parasites.
And why do I have all these scabs and stuff?
I don't know why you have the scabs. Sometimes people pick on their skin a little.
Oh, I see. Are you going to go there, doctor? Is that what you're going to do?
Yeah, so
Okay, doctor.
I think there are things I can
So are you saying you're suggesting I have mental health issues? Is that what you're suggesting here? Say it.
I do think this is a psychiatric condition.
Oh, okay. Thank you very much. Thank you very much, doctor.
Thank you.
There you have it. That was April 12th, 2023, folks. All these dated October 2020. And it is on record that I contracted this in 2016. So, I just have a couple more things to say in regards to what you just heard. I have a lot more other records of encounters that I'm going to share with you. I have to. I need help. I have to. You know, people got to know I'm not making this up. I'm not crazy. This is real. You know, I need help. Anyone out there can help me? Help me. So anyway, I just want to say this. You know, these academics that are just, you know, they know everything. You know, they know enough that they could all call me out for having a mental health issue. But yet, okay, in all this time that I've been going to ER and trying to get help, never once did I ask for or take any requisition prescriptions for painkillers. I am not into pain pills. I am not into drugs at all, except I smoke a THC vape pen. Once in a while I'll smoke a bit of weed in a pipe, but that's the extent of my use. Drinking, I don't drink that much. I maybe once every couple weeks I'll drink a couple Caesars. I enjoy them, you know. I'm okay with it, you know. Anyway, the point being is, you know, a psychosis might come of somebody who has a drug addiction. Well, if you have a drug addiction, you're going to take pain pills. That's what you're there for. You have an opioid addiction. You know what I mean? That's not in my record. So the doctors couldn't discern by that, you know, if she doesn't do drugs, then like, how are they coming by this judgment they're making of me, this diagnosis with just like, because I wasn't conducive to their manner of behavior or to their manner of speaking, because I was rejecting their silly diagnoses after a while of MRSA and Patago. I went to freaking Toronto to be told by a doctor that it was in Papago. I said, no, it's not in Papago. I already know it's not in Papago. She says to me, I have the final word. Okay? Like, no, you really don't have the final word. Because you know what? My money, my hard-earned money is paying for your services, my dear. You are a public servant, my dear doctor in Toronto. Another one on my list that I need to reach out to and say, hey, you are wrong and you treated me unfairly. And you should acknowledge that. It's all coming to a head. I'm doing this for a reason. You know, this is not right. This is not right when I've seen on the internet that a lot of people have this problem. It's out there. I have a friend who has this problem. It is out there. It is going on. Okay? And it needs to be addressed. It needs to be acknowledged. Because if it isn't, then that might suggest there's something to hide. Am I onto something here? Say your prayers. Please pray for all the children who are victims in the world, throughout the world right now. You know who and where and what I'm talking about. I'm not going to make this about pointing the finger. But just remember, it's the children. It's in our hands. But again, thank you, Lord, for another day. Thank you that I was able to get this video done. Sending prayers and love out to all of you. Real love. Have a restful evening. Talk soon.